Good afternoon, everybody, and welcome to today's webinar, Asset Tracking in Healthcare. Today, we're going to talk a little bit about utilisation of assets and to their fullest potential within the healthcare organisation using RTLS, and today's webinar is around the AiRISTA product solution set. The agenda for today, we're going to talk a little bit about in technology and the history of in technology and where we've come from. We'll also cover the life cycle of AiRISTA and how they've been around in this industry for a number of years and their involvement. Issues in asset tracking is the next one, where we've seen some issues in how we can actually identify some of the areas where we can help fix some problems, which is a great segue into the section 4, solving the problem. Then we'll dump into the UVS platform, which is the overview of the new platform that AiRISTA has from an enterprise perspective, which will cover off a number of different scenarios and deployment models of the UVS solution for asset tracking. And then we'll delve into some popular healthcare use cases. Right at the end, we'll have some Q&A, and hopefully that should be able to wrap up our 45 minutes today. So just a little bit about in technology. We founded in Perth in 1999, and those of us that can add that up, that means that we're almost 20 years of age. So given that we're in 2019, so we've been around a long time, and we understand this technology when we've been involved in this technology for a long period of time, specialising in Wi-Fi, and then moving into RTLS and BLE technology services within the last 2 decades. We have 33 staff across 2 major locations, obviously Australia and Southeast Asia, with offices in Sydney and Melbourne and on the Gold Coast where we're headquartered. Our Southeast Asia headquarters is headquartered in Manila in the Philippines. We're one of the last remaining still true value-added distributors where we help our partners deliver services. And some of those services are around, requirements analysis, predictive and post-deployment Wi-Fi surveys, also doing things like BLE surveys today as well, where that's also the new technology that seems to be coming in quite quickly. We're helping with implementations, configurations, all the different types of things that we can do as offer as value-added services to our partners and ultimately their end customers. Not only do we do that from a front-end perspective, but we're also the support arm for the technologies as well that we represent. So moving on to today's presentation, I'd like to introduce you to Mar2019, our Chief Technology Officer for In Technology Distribution, who will talk you through today's presentation. Thank you, Armin.
Thank you, Jason. Okay, thank you very much. So my name's Mar2019. I'm Chief Technical Officer here at In Technology. Talking with and about AiRISTA today. And obviously I'll be going into a lot of detail around asset tracking. And we'll talk about some other topics as well near the end to give you a good overview about AiRISTA and how we can solve problems that involve location and location-aware systems. A bit about AiRISTA. So AiRISTA has been around for quite some time. It's been around working with location services with a variety of different technologies like passive RFID, like GPS, BLE, Wi-Fi, and blending them all into a single cohesive system. And they've been doing that for a wide range of markets, including healthcare, obviously, but also aerospace, oil and gas, and other kinds of workplaces. So the key takeaway from that is that we have a lot of experience and we've got a lot of interest in solving a lot of problems. And we see a lot of parallels around problems within location-aware services, things like healthcare, and obviously with asset tracking, there's a wide variety of assets you can track. And it's likely UPS has got a solution for all of those. One of the key things that AiRISTA is working on this year is integrating a lot of the assets that have been acquired over the last couple of years around different technologies, around Wi-Fi, as well as interesting workflows that have come about from the recent acquisitions. And that's when we talk about the merged companies that have got acquired in 2017. Obviously, this year we're looking at a major release of UBS, which is the platform that AiRISTA has developed to deliver a lot of the locations-based solutions that customers actually need. Now you can see here on the Gartner Magic Quadrant, AiRISTA Flow is one of the leading challenges around indoor location systems. And when we talk about indoor location systems, when we talk about RTLS, it's very much the same kind of concept. It's just called in a slightly different way. Some people call it indoor positioning, some call it indoor location or real-time location. Obviously, the definition of real-time very much depends on the application. We believe that AiRISTA Flow is very well placed, and Gartner obviously agrees with us there. In part because we're vendor neutral, we don't integrate with, or we don't have or sell our own Wi-Fi hardware in the sense of the access points. However, we do partner with most of the other organizations, in fact not most of the enterprise wireless vendors. And the fact that we have our own tags gives us a unique position to be able to deliver on a lot of the use cases that a lot of the other vendors struggle with. Some will have single point technologies, whereas we will have lots of different technologies. And we're talking a lot about RFID, about BLE and Wi-Fi, and there's a lot of interchangeability as well. And you'll see that when we talk about the different kinds of use cases, specifically around asset management today. Now, when it comes to asset management, the core issues we've got are all around, obviously, what is an asset? An asset has a different meaning to different organizations. And in the healthcare space, it can vary as widely as surgical equipment that needs to be tracked and cycled through, down all the way up to massive large beds. So things like that may not seem to be hard to lose, but can still be hard to manage, particularly if you don't know where they are at any single point in time. And that's a key issue that we find, is that there's a lack of visibility on where assets are, which causes impediments towards managing those assets effectively. And so real-time location, or even just periodic location of assets, is a critical driver for improving workflows around asset management. And obviously we're talking about loss of assets, wheelchairs disappearing from car parks, misplacement, IV pumps being put into the wrong location, the wrong storeroom that no one looks at, asset condition as well. There's continual maintenance that needs to happen, particularly on medical equipment around IV pumps, making sure they're sterilized, asset availability, obviously, making sure you have enough of things, but also avoiding the natural tendencies when there's issues with assets and when there's underlying problems around how assets are managed, you tend to get people like nurses who their primary driver is delivering patient care. They may have a habit of doing things like hoarding. And when you're hoarding, that can have this knock-on effect of delaying care and other services. That's not to necessarily mark them down for anything like that, but that hoarding process is something that's driven by poor asset management overall. And certainly that's a key problem that we'd like to improve. Now, the biggest problem we see is RFID. Passive RFID can cause a lot of problems because you can't necessarily track it everywhere. You usually need to have gateways and things like that. So active systems are usually the most effective way for tracking very large assets. Now, there's different kinds of assets, and these are a couple of examples here. This is to help you understand the value of the problem, the value that active tracking of assets can actually bring. Even a wheelchair at the standard rate that hospitals pay for them can be up to $300. And I literally was at a hospital last week and I saw in an alcove, I think I didn't do a head count, but there was about 24 brand new wheelchairs all collapsed and ready to be used. Now I can pretty much guarantee you by the end of next year, or in 12 months from now, there won't be 24 there stacked again. They'll either have been used and put out into the field, into the different wards, or alternatively, someone may have taken one home. And it's likely going to be more than one to be taken home. Now that adds up. Same thing goes for IV pumps. If they're broken and no one knows about it, we've had stories of IV pumps literally sitting in a corridor for weeks on end or days on end because no one knows that it's broken. A nurse will find one that works and continue on with their patient care, but no one's actually gone to tell maintenance that that one IV pump is broken, because that ends up being someone else's job or a secondary task. But even things like ESCIs, frozen content, even things like temperature monitoring or mobile temperature monitoring, computers on wheels, which can be, I think that's actually a lower estimate on the value of those. The value of those to a nurse or to a doctor in terms of things like electronic medical records. If you don't have a computer to enter in those details, then that delays patient care. But even something as expensive as a dialysis machine, yes, it may be more expensive. You may not be able to, it may not be hard to find because generally each hospital has its own dialysis unit, but if it's broken and no one knows, that's a big problem. How do we solve this problem? So the first thing is attaching something to an asset. And big assets and small assets, IV pumps tend to be quite challenging because they're a single metal rod in many cases, and that's the only place you can mount something. Or even just wheelchairs, there's a risk of damage to those kinds of assets. So AiRISTA's got a number of different tags to help you track and attach to an asset. The A5 is one good example of that. It's water resistant, which means you can have it in the shower if it needs to be sterilized. It's got real-time accuracy, so when it moves, it will report back over either a Wi-Fi or a BLE network. It's also got infrared capability, and it's got a button as well. So the button allows you to basically report if something is broken. You can notify someone. So an asset can speak up when something's wrong. So rather than having a nurse put it out in the corridor and then leaving it, and hopefully they'll remember to tell someone, they can press a button, get on with their job within seconds, and maintenance can be come back. You'll see that with a lot of the other tags as well. We've got remote updated configuration, so you don't have to do a lot of back-to-base work. And what that really does with these asset tags like the A5 is allow you to have enterprise-wide intelligence around where assets are. An A4 is another example of an asset tag. Obviously, this one's got a very good bracket mounting capabilities, so you can mount it, you can strap it, you can glue it, and you can have it in a way that's still replaceable. The key difference here between the A5 and the A4 is non-replaceable versus replaceable batteries. They still have both BLE and Wi-Fi capability in the very latest releases, and this one also has infrared capability as well. But certainly with BLE, there's less of a need to worry about infrared. But you can choose based on your location and your customer requirements, which tag suits your purpose. They all allow the same workflows. In this case, you've got two buttons. You can say needs repair, needs sterilization. Very simple assignment of tasks, which they both are programmable based on the backend UVS software. They also have lights and alerts, and so you can do things like motion sensing. So if you attach one of these, and we've seen these used in actual hospitals, they're attached to electronic wheelchairs. If they hit the car park, which they shouldn't be at, they can alert maintenance to go retrieve them on the spot so they don't go missing. Lastly, another example here is the T4 asset tag, and this is one that AiRISTA developed themselves. Again, it's BLE and Wi-Fi. You can have it in both options, or you can have it in one technology or the other, but it's the same physical form factor. And the flexibility of the T4 is such that it comes in lots of different shapes. These are two examples here you can see on screen. One is the top right is the winglet form factor, which basically you can attach to, as I said before, to a dementia patient, for example, to make sure that they don't go wandering by themselves. They're usually in diminished mental capacity, so they don't necessarily understand a whole messaging system, or that they need to tell someone that they're about to leave. So being able to attach something like this as a convenient asset, which is waterproof and water resistant, is quite useful. Another example down the bottom left is one that can be attached to a keychain or screwed in or glued in, and there's lots of different mounting options there as well. Again, these can be upgraded over the air and they can work over any wireless network, as well as be able to work with the AiRISTA Bluetooth infrastructure. Now, the key benefits here is all about taking location and using that. So improving the clinical workflows. And we talk about the current clinical workflows. If you don't have location data, what that means is, and this is what hospitals do right now, is they have nurses who literally spend 1 to 3 hours either daily or weekly going through floor by floor to collect either broken or equipment that needs to be maintained. And that's a significant labor investment in terms of operational expenditure. And that's one nurse or one aged care person that isn't taking care of the patients and the residents. So be able to automate that process saying, well, rather than walking the entire hospital, these are the areas you need to go to, but also be able to split that up and saying, okay, well, rather than notifying a nurse to go collect something, how about we notify the maintenance staff so that when they're doing their rounds, and usually they have very different schedules, they can make efficient use and make sure that they're always supplied with work to do. So they're not, for lack of a better word, twiddling their thumbs, wondering whether something's broken or not. Also allows the maintenance crew to keep predator maintenance records as well. So when you know that something needs to be maintained, they can find it, they can maintain it, which means the quality of service that these assets provide is increased as well. I've given the example of product loss as well, as avoiding assets, and all that feeds into regulatory compliance as well. So if you're worried about cross-contamination of particular assets, like an IV pump, if it's been reused for someone who may have a communicable disease, you can actually track that and see which room it was in, how long it was in there for, and what kind of exposure other patients may have had to any kind of infection risk. And that overall increases patient satisfaction because it means they get a bed when they need it, They get a wheelchair when they need it. They get an IV pump when they need it. And all these elements, which, as we've known when we've all been to the hospital, can be very, very time consuming just by waiting. So reducing the waiting times in terms of actioning patient requirements is a key thing around operational expenditure. And obviously not having to have as many spares. I've seen estimates that at least 20 to 30% of additional assets are needed in order to cover off the fact that they just can't find stuff. So that, as you look at the cost of assets that we talked about before, is significant. So the total cost of ownership is significantly impacted in a good way when you add location. Now, this is the ROI lifecycle. We talked about recall management. So what can you do in an automated fashion? And this comes down to a combination of the tags that we attach and the assets that we track, and the UVS solution, which has the workflows that you need in order to simplify the process. And we've seen this with other workflow requirements around location. A big problem is auditability as well as reporting. And a lot of that is automated through the UVS solution that delivers on assets. So we're talking about recall management. If there is a device that needs a recall, you need to know on that time when you receive the recall notice, has that device been used? Is it in use? How do we find it and how do we get it back and back into service as quickly as possible? But even par level management, be able to plan ahead when there's a life cycle of assets, knowing how many have they actually been in use? Have they been sitting in storage or in an alcove for 3 months in a row? Or have they been used on a daily basis? That kind of par level management is extremely useful and is very, very hard to justify from a cost benefit point of view if it has to be done manually. Obviously, that feeds into maintenance as well as rental management. If you're renting your assets, you need to know, A, that you're getting your best money out of them, but also when they have to get returned, that you're not up for return or non-return fees, as an example. And that feeds into things like fulfillment, staff satisfaction, as well as obviously the CapEx and inventory management. And that's all around the locating of equipment. It's a cycle there of ROI. Now, I apologize for the small text of this slide, but this is just to highlight the level of workflows that the UVS solution actually has. And this is all around the software side of things. Yes, we have a location, but how are you going to use that? How are you going to use that most effectively? And location can be provided through staff messaging, for example. You can have a staff with what's called a staff tag, a B4 tag that AiRISTA also provides. And wherever they are, an orderly can be notified that a wheelchair needs to be picked up or a bed needs to be picked up. But you can also have other workflows around maintenance staff, nurse units in charge, infection control teams can all have individual workflows assigned to monitor and track the assets as they need to. So you can do a quick search for a tagged item. Nurse needs a wheelchair, they can find the closest one. They can find the real-time location at that time. That feeds back into that loop. You can find out, okay, well, I've got a wheelchair here that's in the room, but it requires maintenance. By pressing that button, that can be flagged as such, avoiding broken equipment being put into use. Notifications and alerts, so if there are business rules around infection control or maintenance, you can say, don't use this IV pump. That can be implemented through software as well, all by just having the data in the system about the required maintenance cycle and feeding in the live data based on location and events. And you can see those events on a single dashboard for stakeholders to have, as well as provide overall multi-site business intelligence as well. Now, the missing asset report, this is one example of a very simple report. Now you can see here we've got a lot of detail on this, but it's very clearly and easily presented. And this is obviously just missing assets. This is one example that is a very pernicious problem. We just don't know where they are. And you can report on these. So these are the ones, for example, that haven't called in or haven't been reported as being in use for quite some time. You can immediately say, okay, well, this is the list. You can give this list to the maintenance crew and say, use our tools to find these assets and bring them back into service. Another example of a very useful dashboard here. So you've got obviously the clear green and red, so you can see whether your criteria and your performance criteria are being met around asset utilization. And these are all highly customizable to your organizational needs. But you can also look at things like, as you can see, the missing assets, you can see maintenance reports, you can see asset utilization, par levels, all those different elements you can bring into very simple and straightforward dashboards. And as always with any kind of location-aware system built on AiRISTA, you can get a map with your assets as well. You can have very detailed maps. You can filter by different types, so you can see the distribution at any single point in time, or look at historical distribution as well. And that's part of the forensic replay. You can say, well, where was this asset taken during this point in time? What is its history? Where has it gone? You can compare two assets and see, well, why was this one not put in use? Was it placed in the wrong spot? Is it too hard to find, for example? And that helps you guide your own workplace policies. You've got multiple map views as well, so it's not just linked to one map. You can look at a building, you can look at a campus, and with the UBS solution, you can look at an entire health network if you need to, particularly if you have assets traveling via ambulance or staff taking different equipment, a bed that gets a patient transport bed. You need to be able to track across multiple sites. You can do that with the UBS solution. The UBS solution, let's talk a bit about that. What does it actually provide? Obviously, you've seen practical examples in the reporting, in the real-time alerting, and that's all through the data mining and trend analysis that's built into the software. You've got ad hoc reporting as well as a real-time notification. So you've got the real-time offer functionality that you can deliver to your on-the-ground staff, as well as your back-end reporting that you can deliver to your stakeholders and your management to help define policy and make sure everything's running as smoothly as possible. It's all done through a really nice and easy-to-use web interface. So it's very user-friendly or graphical. So you can use it on any browser, including mobile devices and tablets if you want to. And you can use it on computers on wheels if that's the kind of interface you want to provide to your staff. So regardless of what kind of interface you've got, you'll know that the UBS solution can provide that to your teams. You can analyze trends, and it's real-time and interactive as well. Now, I'm not going to go too much detail into this kind of slide here. This is an example of the level of the scalable architecture that UBS has. We can handle passive RFID. We can handle barcodes and barcode scanners, and we can feed that back into the system. So if you have a barcode and an active tag, that can be linked to the same asset. If you have multiple parts to a single component that you want to track as a single unit, you can do that with UBS. And if you have a third-party GPS device or a mobile phone, you can track that with UBS as well. You can build that all. So if you're tracking digital assets as well as physical assets, they can all be built into the same workflows. We include sensors there as well. We can do temperature monitoring, and you can combine that as well. If you have a portable fridge or a portable freezer or an ice box, you can track that to make sure the asset's being used, but also that it's within tolerances. So you can avoid the risk of things like medical spoilage. All that feeds into the data collection system, gets processed, and gets dispatched through the web interface and the outbound interfaces as well, which can include other tags as well. So you're not reliant upon interacting through a laptop or a desktop. You can interact through the tags that have messaging support as well. And we have lots of integrations with lots of third-party systems like nurse call, security systems, as well as other elements as well. Now, the scalable architecture, as you can see, there's a lot of thought being put into this. And we can go down to the bed level, so we can know which bed an IV pump is actually placed at, if you wanted to. We can go door level, which ward it's in, which room, as well as looking at a holistic view, looking at a campus and multi-campus view, and that's all supported with a single server infrastructure. Now, to deliver this, you can deliver this now with an existing Wi-Fi network, depending on the accuracy that you want to achieve for assets, and that all depends on what the customer requirements are. You can deliver that with existing Wi-Fi infrastructure, or you can enhance that with either by expanding your Wi-Fi network, which is part of the services that Jason mentioned that we offer around designing that effectively for good asset tracking, but also enhancing that with more specific technologies like BLE. Now, this is a little sample of all the different tags that we have. Obviously, you can see there's lots of different workflows we can enable. Once you've delivered location services for asset tracking, you can also layer on other workflows over time. So you're able to reuse your investment into location infrastructure and expand that out to things like obviously asset tracking, patient safety as well, staff safety, workflow optimization, as well as important things like hand hygiene and infection control, as well as temperature monitoring. So all these different bits use the same infrastructure, same kinds of tags like the T4, and the same Wi-Fi network. I'll skip over the technical details. I'll just highlight the fact that we can operate with any kind of wireless vendor in lots of different modes. And so if you've got an existing network infrastructure in place, we'll be able to run over the top. And that's part of the vendor neutral approach that AiRISTA is very strong in. We also have our own BLE infrastructure as well. We can use third-party beacons to a degree for location services, and we can use that as well as enhancing when you've got other solutions like wayfinding that require BLE. You can reuse that infrastructure, or you reuse either the AiRISTA one you're using for asset tracking for wayfinding with one of our other vendors, Connexiant, or vice versa as well. Again, reducing the total cost of ownership of any kind of BLE deployment and improving the operational workflows around location as well. We can be fully redundant setup, so you've got the trust that the UBS solution is going to scale with your organization. We can go on a single site deployment, so you can just have one, or you can have a tightly integrated centralized deployment. And we see these models, a wide variety of models, I should say, in Australia being used by both private and public organizations. Okay, so that there's a couple of other workflows we're going to talk about. I might just jump to the Q&A and see if we have any questions. Jason.
Thanks, Armin. Yes, we've had a couple come through. Could you give us an idea of how this could work with surgical instruments, please?
The surgical instruments are an interesting case. The challenge there is that obviously an A4 or a T5 are far too large. I can't imagine a surgeon wanting to use any tool with that kind of large block. Even though the A5 is only the size of two-thirds of a finger, it's still too big for any kind of asset tracking there. And that's where the cross-technology integration that UBS provides is very useful. I'll just bring up the slide here. So you can see here we've got passive RFID support as well within UBS. So be able to have little grain-sized RFID chips embedded onto devices. One of the vendors we have has that kind of solution. We can integrate that into UBS to allow simplified alerting and notifications through the same systems and notification systems that we use for asset tracking and staff safety. So basically little attached RFID modules, which are autoclave, which can be run through an autoclave and won't get destroyed during sterilization, are the best way of managing those, and they can be very inobtrusive and very effective. And what we've seen is that the surgical tools do migrate. Obviously, they have surgical kits for each individual procedure that are pre-done, and you need to have the confidence that when you're scanning with passive RFID using a tray approach, you can scan, you'd have a good success rate, as well as ensuring that you've got good record keeping to prevent that cross-infection.
Thanks, Armin. Just in relation to that, this sort of leads into the next question. I've got a question here around IR and ultra wideband. They still used in asset tracking?
So infrared and ultra wideband can be integrated as third-party hardware and software. However, what we find is that BLE and Wi-Fi are the far better total cost of ownership. When you look at the tags that AiRISTA's developed, they're BLE and they're Wi-Fi capable. You can choose which one to use. You can have localized elements of BLE and the rest to be Wi-Fi. The challenge with ultra wideband is that accuracy is not the best. It's very hard to achieve indoor room level accuracy with any kind of ultra wideband solution. IR has another challenge where it's good for gateways. It's not really good as a primary mechanism of determining location. Obviously, AiRISTA does have the IR beacons that it can be used, and the tags do support that, but they're most suited towards gateway style, have I passed this point kind of usage rather than blanket approaches of IR. Primarily, obviously in Australia, we have the situation where we have a very large IR emitter in the sun, and that can cause some problems with modern design buildings. So we find BLE is a far better option and serves the same purpose, usually at a lower total cost of ownership.
Great, thanks, Armin. How can asset tracking be tied to wayfinding, such as Connexient in healthcare?
So wayfinding is all about BLE. So in most cases, wayfinding is using commercial clients and personal navigation devices, so mobile phones. And that's really the key technical difference between wayfinding and asset tracking, whereas with asset tracking, we're using dedicated hardware devices to track with. However, they can use and leverage the same BLE infrastructure. So BLE units and access points BLE put around the place can be shared between them to reduce the overall total cost of ownership. They can also be integrated on the back end as well if you wanted to. On the software side, both the Connexient platform and the UBS platform do have APIs which allow that kind of tight integration if you wanted to.
Okay, and you mentioned about tracking eskies and things like that. So how would that apply in the pharmaceutical industry?
Well, assets in the pharmaceutical industry vary in terms of their type. Obviously, we've got things like blood vials, which might be tracked via passive RFID as an example, which we can integrate. So you might have a combination of factors where we track which vials are in an esky, and we use active RFID to track the esky itself. And we can use a combination with the T4 temperature tag, which you can see in the middle there with that wire there. That's got a sensor probe, so you can combine temperature tracking, temperature monitoring to make sure that there is no spoilage in transit, along with location to make sure that it hasn't been left anywhere or has gone the most efficient route, as an example. So it's a very powerful combination of, and this is a good example of combining the different technologies all to a single asset. We can have workflows implemented which track the vials in the eskies or the materials in the eskies, as well as tracking the eskies themselves, being able to see where they come apart, where they diverge and where they come together.
Is an interesting question. Outside of healthcare, where else do you see asset tracking as being implemented?
Asset tracking has a wide variety of use cases. Obviously, today we're focusing on the healthcare side of things, but it can be used for all sorts of different active assets. We've seen interest in tracking educational assets, as an example. So laptops, trolleys, and those kinds of elements. It can also be used in the retail space as well by combining passive RFID as well as manufacturing as well. So by combining passive RFID with active RFID, we can co-correlate, which is a key distinction that a lot of other technology and a lot of other vendors don't have, is that co-correlation, which is a concept of taking one element of information and another element of information, in which case is 2 points of location, and combining that into a single coherent bit of information. I'm getting a bit technical there. But hopefully, what that means is that can be used for all sorts of different scenarios. Tracking small assets and big assets as they pass each other, as they go past. It can be used in shipping, logistics. There are lots of different ways of combining those bits of information and improving what are generally manual workflows, either with a higher risk of inaccuracy or a high amount of effort to deliver.
You mentioned about being vendor agnostic or vendor neutral. In relation to BLE devices, does AiRISTA support all types of devices or just their own?
So AiRISTA has different kinds of parts of BLE infrastructure. So this is an example you can see on screen. The one down the bottom there is our BLE to IP gateway, and that's our bridge component that allows our BLE tags to talk to our BLE server. But in between, we have the ability to use different locators as well as third-party locators built into access points and those that are used for other BLE purposes, and collect that information to assist us with improving our location services. So we can use, obviously you still need an AiRISTA tag, but the BLE infrastructure that's built into the environment can be third-party if you want to choose that.
So does that mean I can, question for me personally, does that mean I can use my my key locator that I've got, my little icon with an AiRISTA solution, or?
Maybe. The challenge there is that the key locator doesn't know how to talk to our server. And so it's a very uncommunicative device. It's more designed as a substitute for an asset. If you had the T4 winglet on you, then yes, we'd be able to track you. And that's a good example of having an AiRISTA specific technology to meet that workflow, to deliver that use case.
So the consumer market's really not where we're going. It's the enterprise market, such as beacons by Polestar or something along those lines, is where you'd be recommending. And
that's right. So a solution like Connexion that uses BLE, uses consumer devices, whereas AiRISTA's solution is more focused on industrial applications with customized tags for different workflows. And they're a companion, and they serve different purposes. There's not much conflict between the two in practice, we find.
So given what you know today versus where BLE is going, I mean, what would you do in relation to a BLE or a Wi-Fi network when it comes to asset tracking?
When it comes to asset tracking, having good Wi-Fi coverage is always a good thing. Wi-Fi is critical in any infrastructure today, but certainly being able to augment a Wi-Fi network which AiRISTA supports with localized BLE improvements allows us to get very close. With the combination of the AiRISTA infrastructure and the AiRISTA tags, we can actually build out a very, very detailed requirement. So if you have very specific needs in one area, you can use BLE for that. And we have broad location needs, you can use that in other.